Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations, Global Health Solutions. And the abbreviation of our health group is SGHS. So the first S stands for Snowspirations. Snowspirations is my brand name in social media. Then the other G stands for Global and Solutions. So Snowspirations SGHS is actually a global brand. And I just want to use one of few words to explain what we stand for. So principally, SGHS is a group of few committed members who love humanity. So the common denominator in SGHS is love of humanity and servant leadership. So we have just about, I think we have about 6 core staff of SGHS, starting with my COO, Chief Operating Officer, Engineer Kene. Then I have a co-provider, Dr. Ndichie Nkem. Then I have a moderator, Chinyere. I have a group expert, Onyinye. Then I have my graphic designer, amazing guy, Ebenezer. So these are the core staff, the core admin of SGHS. Now you might be wondering what SGHS actually, stands for. So we actually want to help you to achieve your family. We understand you've been wanting to start your family. You want to have your boys, you want to have your girls, and you want to have twins, you want to have triplets. Unfortunately, you might be having challenges. Unfortunately, you might not really understand your body properly. Or unfortunately, you might not understand the concept of PPP. So what we actually do is to show up every day by preaching the right message, by helping you to understand your body better. Like every woman is supposed to understand her cycle. Every woman is supposed to understand where she might likely ovulate, your fertility window. And when you understand this, you are supposed to understand the natural role of lovemaking towards starting your family. Now, when you understand this, just like anything that happens in life, if you're having delays in starting your family, you have to understand it's a delay. It's not a denial. And we are going to be challenged anyway. So long as you're living, you're going to be challenged. The only time you will stop having challenges is when you go down 6 feet. Now, majority of our members have infertility problems. Your infertility problems can be primary infertility if you haven't been pregnant before, or secondary infertility if you were pregnant in the past, but currently you are not able to become pregnant. So it doesn't matter the type of infertility you have. What matters is what you're doing about it. Now, personally, I started my journey in maternal health since 2015. Actually, the reason why I started my interest in maternal health and actually child health is because my daughter, Zara, was born very early as 26 weeks. So she was extremely preterm. So preterm is a baby that came in before 37 weeks. Now the experience I had when my daughter was born actually changed my orientation, my understanding, my career from clinical medicine to public health to maternal health. So I have an advanced degree in maternal and child health epidemiology. So I started with using my knowledge to teach, to guide, to refer, to guide you in the right direction so that when you understand what the problem is, you can begin to do the right things. So since 2015, my message is very simple. Understand that God is at the center of everything. So our first mantra is we pray to God. We pray a lot. We are the praying group. Now, when you understand that God is at the center of everything, you have to be mindful of the type of prayer you actually pray. Your prayer should be a prayer of petition. You remind God that God said He's going to make you a mother, a father. Now, when you've done that, you have to take responsibility. Your responsibility is to make love with your partner. And if you're having difficulties, 48 hourly. That means if you make love today, tomorrow you have a break, then you continue the following day. Now, when you have done the first 2 P's, the last P is actually the kind of summary of everything. So it's called practicing. So when you pray, make sure your prayers are effective prayers. Make sure you make love 48 hourly. Then practice. So practice means putting everything I've been teaching you guys since 2015. The message is the same. It has not changed. Lovemaking is the same. It's inexpensive. You can easily get it. Now, if you have been wanting to become pregnant by yourself naturally, I want you to focus on 35. 35 is a critical age in the life of a woman. You see, when you compare a woman and a man, women have a big disadvantage when it comes to fertility and starting your family. So long as a man is alive, he can father a child, even very late in life. But a woman is like a flower. You are not going to be fresh forever. You have a specific period you can have all your family. It's called your reproductive phase of life. Now, if you don't use your reproductive phase of life to start your family, you can still become a mother, but you need to have someone else's eggs to begin that journey. So why is 35 critical in the life of a woman that wants to start her family? Because at age 35, you're considered advanced in maternal age. So you are likely going to have fewer eggs. Then out of the fewer eggs, they might be of fewer quality. You might begin to have challenges. You might begin to have delays. So when you get to 35, the approach to your infertility will change. So when you have done your best within the 6 months, if you don't get a result, you transition. You need the help of a fertility specialist. You make sure you follow your realities. What I've noticed, we are very selective in the information, in the things we are interested in. We want quick fixes. So women are easily carried away when they see pictures, when they see me posting prayers, when they see me posting motivations. But only few women actually act those prayers and actually take the bold steps. My people, my message has been the same since 2015. 2021 is about to end. We have 2 more months. So the question is, what are you going to do differently in 2021 to make sure you at least become pregnant on the 31st of December 2021? Are you praying the right kind of prayer? Are you making love enough? Have you seen a fertility specialist? What exactly is the problem? Is the problem coming from you? Is the problem coming from your man? Do you have a fertility specialist? What are the options? Do you have a need for IUI, IVF, surrogacy, adoption? What is your game plan? Besides praying, besides showing up as a member of this group, have you really told yourself the frank truth? If you need help, have you sought for help? If you need to talk to me about your challenges, have you done that? Do you have a subscription? Or have you been sending me messages since last 5 years, knowing fully well that my inbox is not the right channel? Do you know how to get the best help? I am committed to help you. When I see your babies, I glow. The most important thing that makes me happy every day is seeing babies out there. So please take your bold step. If you need to consult with me, you can come in. I'm very, very free. The only thing you can see me do is to stand firmly on what I believe in. And I believe that every woman out there is a mother. Every singular woman out there. So if you need help, come, let's fellowship. If you don't have enough resources to consult with me, I've structured my packages to be user-friendly. You can come in for 1 week. 1 week can make a lot of difference. You can come in for 1 month. 1 month can make a lot of difference. You can come in for 3 months, 6 months. I'm not trying to be exaggerating, but there is absolutely no way you can hang around with me for 1 week and I drill you the right way and you won't become a mother. So come as you are, okay? Now remember that we have a special event on the 31st. It's a workshop. It's a combined workshop for believing for baby mothers and women that are already pregnant. Remember that once you are pregnant, it hasn't ended. You have to have smooth pregnancy. You have to deliver your baby. So thank you for sticking with me. I love you. You know I do. This is my passion. So let's collectively achieve the aim of starting your family. Stop procrastinating. Take that bold step today. Go and subscribe. Prioritize your family. Your babies want you the same way you want them. Okay, so thank you for coming this afternoon. Make sure you attend all the clinics. Make sure you play your own part. Continue praying, continue playing, and continue practicing. God bless you and bye-bye.